Hello, I'm Jeff Baldwin. I'm an instructor at Alamance Community College, and today we're going to be going over a patient assessment. The assessment will consist of a primary and a secondary assessment. We have a lot of information to cover, so let's get started. A couple of things I want to tell you is, first off, I would like for you to take notes if possible, because there's a lot of information that I will be going over and at a fast pace, so you'll need to try to take those notes so you can keep up with me. All right, now a couple of things to keep in mind, and we'll get started from here. Here's what we need to do. We need to first set our scene. Our scene's going to be a BLS truck consisting of two of our crew members on that truck. This truck will have basic life support equipment on that truck. Now, our scene will be dispatched and we will be going to a residence of a 37-year-old female. The patient is complaining of dizziness and also feeling like she's going to pass out. So we will be dispatched to this call, emergency traffic. When we arrive on the scene, the first thing that we'll want to do is to make sure our scene is safe. At this time, our scene is safe, so we will proceed on in. We do have a live patient. This is my wife, Casey, and she will be assisting us today. Okay, so when I arrive on the scene, the first thing I want to do is make sure that I have my PPE. The proper PPE on this call would be gloves. Other things that you might want to consider on this call for your equipment would be a face mask, also either a shield or goggles, and even a gown. So when we arrive on the scene to this patient and we enter the residence, I want to first introduce myself. Hi, I am Jeff with Alamance County EMS, and what is your name?
Casey.
Casey, hi. And so can you tell me how you're feeling today?
Woke up, trying to get started for the day. I'm a little bit lightheaded, a little nauseous, feel like I'm gonna pass out. I don't know. I do take blood pressure medicine, so
Okay.
I don't know if it's low or if it's something else.
Okay, so we're going to stop right there and I'm going to explain a few things of what we're covering. First off, we're covering our ABCs. I see that she's talking to me, so she has the A, which is the airway. The next thing that I see is I was looking at her chest to see if she has a rise and fall, and she does, which covers our B for breathing. The third thing that I'll need to cover, and that's when I take my vitals, which will be blood pressure and a pulse, is circulation. So another thing that you need to do, first off, with this patient is, before you touch her, you need to get her consent. So Casey, is it okay if I touch you and do some things as far as taking your vitals and stuff?
That's fine.
Okay, now another thing to keep in mind, if this patient was possibly hearing impaired, at this point what I'd want to do is I'd want to elevate my voice, because if she is hearing impaired and she can't hear me and she can't understand what I'm saying to her, then we've got a communication problem there. The next thing I want to take in consideration is if she is maybe an elder patient and she has issues with hearing high-pitched voices, which is very common in females. She might get confused, which will confuse me into thinking, am I dealing with somebody that has dementia or is possibly a stroke patient? That's something to keep in mind and consideration. Always make sure when you're doing anything as far as vitals or any medical procedures to this patient that you explain to them and let them know what you're doing. If you're dealing with a child, something you would want to do is I would want to get down on their level, because a child's going to be very scared. So anytime I'm doing anything, I will tell that patient, I want to take your blood pressure, I want to take your glucose, I'm going to need to stick your finger. Any of those things that I'll be doing along in this patient assessment, I'm going to talk through to my patient and let her know. So at this point, I have covered my A and my B, and now I'm going to start into my vitals. But before I do that, I've also covered a couple of other things. And what that is I've covered her level of consciousness. I've asked her name. I've asked her her age, which I've already got that in the assessment from the beginning, which was in our notes, but I might can ask her that again just to make sure she's okay on that. Your level of consciousness is your 4 or your 3. So that's something very important that you need to make sure you know and you cover. So your level of consciousness is, Casey, your name is Casey. Okay, and then your age is?
37.
She's 37, okay? So she knows her, so she is alert to her person. Okay, the next thing is, Casey, where are we right now?
At home.
She is at home. So now she's alert to her place. Okay, Casey? Now, the next thing is, can you tell me what was going on, what was happening?
I am actually dizzy right now.
She was actually dizzy right now. Okay, so she was actually dizzy then. All right, so now she's alert to place. And then finally, I want to find out from her if she is, okay, so if you are feeling like you're going to pass out right now. So let's go ahead and move on right now. Since she's saying that, we're going to move a little quicker, which would be I would go ahead and take her blood pressure, okay? At this point, I would take my blood pressure cup out, and I would go ahead and put it on her arm. Is it okay to take blood pressure in this arm
That's
here?
fine.
Okay, something that you want to make sure that you cover. And when you're taking a blood pressure, if she has a preference of the arm, or if she has had a stroke or cancer treatment, if it's a female mastectomy, and so at that point, you would want to find out if the other arm is going to be better than this arm. At this point, this is the arm that we're going to take the blood pressure in. So we're going to go ahead and get a blood pressure. Okay. So her blood pressure is 130 over 94 right now. So it could be a little high for her. And at this point, I would ask her, Casey, is that a high blood pressure for you? Or is it normal for you to have that?
The bottom number was what?
The bottom one was 94.
That's about normal, even on blood pressure medicine. My doctors talked about maybe upping my medicine.
Okay, all right. So we take that medication. We're going to go back to her alertness now because we want to make sure she's conscious and alert, which she is. And is she a 1, 2, 3, or 4? We have 3 of them down right now. So, Casey, what day of the week is this?
Thursday.
Okay, so she is conscious and alert to person, place, time, and event. So she would be considered conscious and alert times 4. All right, so the next thing I'd want to take is I do have a pulse ox. And I want to go ahead and get the pulse ox on her finger so I can go ahead and start getting a reading for that. It's going to give me a heart rate, and it's also going to give me her O2 stats. Right now, she's breathing at 100%, and her heart rate is running 79. So that's very good from there. I would go ahead and just keep that on and keep monitoring that. The next thing that I would want to probably get is going ahead and get a temperature on her. So we would go ahead and do this. I just need you to put this under your tongue, close your mouth. And as we're taking this, another thing that I would want to be doing is counting her respirations, which is a rise and fall in her chest. Okay, so she is 98.1, so we're fine on that. And I did my respirations, counting them for 15 seconds, and I've got a respiration rate of 16. 12 to 20 is our normal, so we're in normal range on that. Casey, are you diabetic?
No.
No? Okay. Would it be okay for me to check your blood sugar?
Yes.
Okay, checking the blood sugar is going to be something I would do. I would take one of her fingers. I would ask her, is it okay to prick any of their fingers? I take my alcohol prep, and I would go ahead and clean off the surface there. Now, one thing you'd want to do once you do that is to wipe that alcohol off. It can give you a false reading, and a lot of people get confused about that. I have my glucometer, and I'm going to go ahead and put it together. Get it ready. Once it's ready, I'm going to tell her again, okay, I'm going to stick your finger, okay? I like to go to the side of the finger and do it. It's a little bit less painful for the patient. 1, 2, and 3. Okay, we're done. I'll go ahead and squeeze up some blood out of that and get that going. Okay. All right, so your glucose is 100, which is not bad. All right, at this point, I might want to start asking some further questions. So how are you feeling right now? I'm gonna go ahead and put a Band-Aid on this.
Still slightly a little dizzy.
Slightly a little dizzy, okay. Was there
Lightheaded.
anything that you were doing during this time when you were getting the dizzy? When you're starting to feel dizzy?
No, just up and moving around for the day.
Just
Trying
up
to
and
get
moving
in the
around.
shower,
Okay.
get ready for the day.
Okay, all right, well, very good. Okay, so right now your vitals are checking out okay. We are here and we can take you to the hospital. There is a couple other things that I might want to go ahead and check. And if you would let me, I'd like to just listen to your lung sounds and see if they would be clear or if you have any problems with that. I will go ahead and check the lung sounds. Take a deep breath. Okay, and another. Okay. All right, let me listen to the back. Okay, I'm listening to all four lobes. Everything is appearing to be clear at this time. If we were having any issues, I would suggest you getting a chest x-ray, but right now, everything appears to be okay. So at this point, what I'd want to do is probably go ahead and start my secondary assessment. And during the secondary assessment, you want to do a sample history. So I want to find out, spelling out the word sample, S is for signs and symptoms. You told me earlier that you had a sign and a symptom of you felt lightheaded when you got up, and this is something that you've had happen before. The next thing that I want to ask is the A in sample. So do you have any allergies?
One medication allergy.
Okay, and what is that?
It's Augmentin, and I also had a reaction to surgical tape when I'd had an operation about 2 years ago.
Okay, all right, very good. And then the M is for medications, and what medications are you on?
I take lisinopril and for my blood pressure and Prilosec daily for my acid reflux.
Okay, all right. And then the P in sample is for pertinent medical history. And is there anything that you have history-wise going on? You said you had high blood pressure. Is there anything else?
Not currently.
Okay, not currently. L is for your last oral intake. So when did you last have something to eat or drink?
Probably 8 or 9 last night before I went to bed.
Okay, and then the final letter in the sample is the E, and that's events. So what did you say you were doing that led up to this?
I just got up, got out of the bed, going to brush my teeth, get ready for the day.
Okay, all right. So at this point, we've done our sample history, and if we were, which is part of our secondary survey, if we were going to transport this patient, we would offer her transportation to the hospital, and what we would do as we were going on our en route to the hospital, we would want to get further information as far as this patient goes, and any more information that might help us with this patient, and also with what we will be giving our report to the hospital. So at this time, I would like to ask you if it's just something that you want to seek medical attention further at the hospital. And if you did, we have an ambulance here and we can transport you to the hospital. We're probably 5, maybe 10 minutes away from the hospital to ER. Or if you'd like to just follow up with your primary doctor, you're able to do that too. I'm not seeing anything that's really standing out as far as medical terms go, and as far as treatment that we would need to do. There's nothing that we would do between here and the hospital, since all your vitals are stable and still current. 98 on your oxygen, and your heart rate is 80. Your blood pressure was fine, and your glucose was fine. So there's nothing else that we can do. If you don't feel like you want to go with us, I would suggest you following up with your doctor, and that would be fine. I'd be completely okay with you staying here, but just give a phone call to your doctor. We do have a refusal form that we need to get you to sign, and it's just a form saying we've come out here, we've offered to take you to the hospital and offer transportation. You're refusing at this time, and that we'll just suggest you to follow up with your family doctor, whoever you may use. So if that's okay, we'll do that. If not, we'll be glad to take you to the hospital.
That's fine.
You'd like to just refuse?
Yeah.
Okay, so at this point, what we would do is we would conclude our patient assessment with her. We would take and we would fill out that form, and from there, on that form, we would go ahead and give her her vitals, so she can have those in case she did follow up with her doctor. And from there, we would just clean up our stuff that we've used, our equipment, and we would check back into service, and that would be it. So I hope you've learned something from this, and feel free to reach out to me if you would need that. I am Jeff Baldwin. I'm with Alamance Community College, and I'll be glad to answer any questions that you may have. Thank you.